Can all be signs of any number of illnesses. But a group of MPs is now urging doctors to test people with those symptoms for blood cancer.
Well, a published report on the disease that also recommends better education and training for doctors to help them spot its many different variations, including leukemia, lymphoma and melanoma, Sky's Lorna Shaddick reports.
Making a cuppa after a long day at the office seems unremarkable to most of us, but Wendy Leigh is thankful she can do it. She may not look ill, but Wendy has blood cancer. Diagnosed with stage 4 follicular lymphoma in 2011, she was only told what was wrong after 15 visits to the doctor.
I had to insist on some blood tests, had to insist on some referrals, and the fact that it took over 2 years to finally get into a referral that was to a gynaecologist who he then forwarded me on, just shows how frustrating it is.
Wendy's type of blood cancer is usually incurable, but she was lucky. Despite the long delay in diagnosis, after 2 years of chemotherapy, she's now in remission and out and about again.
It's cases like Wendy's that have led to a group of MPs, the All-Party Parliamentary Group on Blood Cancer, publishing a new report. In that, they recommend that doctors offer a simple blood test to anyone who comes to see them with one or more symptoms of the disease. Things like tiredness, backache, night sweats, things that are often mistaken for other illnesses.
My mother died in 2012 of acute myeloid leukemia, a blood cancer. And one of the things that I was really shocked at the time is that she had been unwell just for a few weeks with flu-like symptoms, and only literally hours before her death did she receive a diagnosis.
Despite 240,000 people in the UK suffering from it, MPs say it's not just the public that don't know enough about the various forms of blood cancer. Doctors also need to improve their knowledge.
We need greater awareness generally of blood cancer as a condition. But they also suggest that GPs should be doing far more testing, and that's not necessarily an evidence-based suggestion, and it doesn't really take into consideration the difficulties that general practice is facing at the moment. We have an under-resourced general practice, we are very short-staffed, we're short of GPs and nurses, and also diagnostic tests and imaging are not always as readily available in the community as we would like.
Meanwhile, Wendy is fighting fit, even enjoying a sponsored hike in Iceland recently for a blood cancer charity. But she hopes this report means the disease often called the hidden cancer will finally become better known. Lorna Shaddick, Sky News.
Let's talk this through some more. We're joined by Gemma Peters, who's the Chief Executive of the blood cancer charity Bloodwise, and one of the charity's patient ambassadors, who is Jane Leahy. Welcome to both of you, and thanks for getting in, albeit through a fairly tortuous journey, Gemma. Jane, tell us about your experience, because part of the report there was focusing on not misdiagnosis, but a reluctance sometimes to say, OK, further investigation needed.
Well, yeah, my situation was quite different from Wendy's, who was just on the report there. I was just very run down, I had lots of colds, I had conjunctivitis, and then I got a gum infection. So first of all, I went to my dentist, who gave me antibiotics. I thought I had an impacted wisdom tooth, but obviously 2 courses of antibiotics didn't do anything. So I went to my GP, and by the time I went to my GP, I was pretty seriously ill, and she immediately ordered blood tests, and I was diagnosed that day and rushed into hospital that evening.
I mean, that's encouraging, actually, isn't it? When you get to GP.
But it was pretty obvious that there was something very seriously wrong by the time I went to the GP. It had been months leading up to that I'd had fairly vague symptoms of just feeling unwell, but nothing that you could pinpoint. I didn't get the night sweats or the other things that were mentioned earlier in the report. So from a patient point of view as well, it's recognising that there is something more serious than just being a bit run down or having a cold that you can't shake off.
And Gemma, that is the point, isn't it? Because these symptoms are so vague and that you can dismiss them yourself as a busy mum, as something else, you're just getting on with life. But also for GPs, until the point at which you went and were very ill, but in those early stages, it is hard to diagnose.
Well, I think that's right. So what the MPs have found in the report is there are a number of different symptoms. Sometimes people themselves don't recognise them as things that they should be concerned about, so they don't raise them with their GP. And sometimes GPs aren't spotting
the link between some things, because we heard earlier it's right about the pressure on GPs' practices. So you might go 4 or 5 times, see different GPs. You might not spot the link between things like not being able to shift a cold and bruising. And so what MPs are calling for, and Bloodwise would absolutely support, is that to give GPs the support so that when they spot one of these symptoms, actually we get the blood test done, because in some cases, like in Jane's case, early diagnosis is just really critical.
We do have more routine screening for things like breast cancer, for example. Is that what you'd like to see for blood cancers?
I think at the moment the evidence says that actually for routine screening we're not at a place yet where the benefits of that would outweigh the cost of it. I think because of that though, it's even more critical that people are aware of what the symptoms are. And as we heard earlier, blood cancer is the 5th highest instance cancer. It's the 3rd biggest cancer killer in the country.
More prostate cancer and breast cancer.
That's right.
I suppose we might look at that and say, we know that, it's a dreadful American phrase, a squeaky wheel gets the oil. I'm not for a second suggesting campaigners for either of those conditions, are doing anything other than something very positive for people who've got it. But the truth is, prostate cancer gets lots of coverage, breast cancer too, right. Blood cancer, it seems less so.
Yes, I think that's right. And I think that's because it is complicated. So blood cancer is 146 different cancers. And the symptoms are quite vague and the treatments are really different. So, this people's understanding of cancer has increased so much over the last, 10 decades. But this isn't a cancer that you can cut out. You can't have surgery. Your treatment path will be very different. You'll be treated in a different setting, not in a cancer clinic.
What was your treatment, Jane?
So initially I had chemotherapy. I had 3 cycles of chemotherapy in an isolation room, so I'm not with other patients and sharing patient experiences. I did achieve remission then, but within a few months I'd relapsed. So I had to start all over again, more chemotherapy, and then I needed to have a stem cell transplant. I had that nearly 2 years ago now, and I'm in remission now, but I'm still dealing with the side effects. And a lot of people think, like, you've had your stem cell transplant, that's it, you're cured. But it's not like that at all. I'm still dealing with, I have graft versus host disease, which causes all sorts of painful and uncomfortable side effects that have to be managed.
One of the other points that the MPs make in their report is the lack of emotional and psychological support available. How did you experience that?
Yes, we've experienced that a lot. I had a young family, I had 2 young daughters, and all of a sudden I just disappeared. I went to hospital and didn't come home for 5 weeks, and then had 20 weeks of treatment in an isolation room. We didn't ask for support at the time, but there really wasn't anything, and people kind of looked blankly at us, and we weren't being treated in a cancer hospital, so it wasn't really, we were on a haematology ward, and the cancer support just didn't seem to be there. So it was something that we kept asking and pressing for, but found lacking really.
I'm afraid that's where we've got to leave it. Sorry, Joe, point just on the tip of your tongue now, we've got to leave and move on to politics now. Gemma and Jane, thanks both very much indeed for coming in.
Thank you. Thank you.